Diabetes is a common illness. Most of us may be aware of its various complications, such as diabetic retinopathy and neuropathy, diabetic kidney disease, and so on. But when it comes to deaths caused from diabetes, cardiovascular complications account for the majority. Diabetes is recognized as one of 4 major factors for developing cardiovascular disease, the others being hypertension, obesity, and cigarette smoking.
About 68% of persons over the age of 65, and this is data now from the American Heart Association, 65% of persons over the age of 65 who have diabetes will die from heart disease, and about another 16% will die of stroke.
Before we take a look at how to manage or even prevent cardiovascular complications of diabetes, let us look at how persons come to develop the disease.
In a nutshell, what generally happens is that diabetic persons have a more rapid rate at which fat and cholesterol is deposited in the arterial system. So we all have that. It's considered part of the process of aging. Fat and cholesterol is being laid down in our arteries. However, diabetic persons tend to have that happen at a more rapid rate. Okay? And as a result of that, what tends to happen is that diabetic persons will progress to a point where they have compromised vessels. So in other words, the lumen, the diameter of the vessel, is narrowed, the flow of blood is limited.
And as the heart muscles become starved of blood, various acids accumulate and persons will tend to experience what is called angina, or a type of chest pain.
You may get complete blockage of the vessel, which may now result in what is called a heart attack.
Heart tissues are not meant to function in an environment where the blood sugar level is elevated. And so, another incidence of diabetic cardiovascular complication results where high blood sugar levels in persons who are diabetic becomes directly toxic to heart cells. This impairs the ability of blood vessels to open normally under conditions of stress, such as exercise, and also causes inflammation and impaired clotting of the blood.
So if they are chronically exposed to those levels of elevated blood sugars, then there are biochemical consequences. There's weakness of the heart muscle, and patients, many of them, go on to developing heart failure and so on.
The diagnosis of cardiovascular complications is more difficult in diabetics, where the symptoms appear unclear or may be different from the non-diabetic patient. Take, for example, a non-diabetic person with, say, coronary heart disease.
Generally, they will say, well, look, doc, I felt pressing pain to the center of my chest. It's moving down my left arm. It comes on with activity. It stops when I stop engaging in whatever activity. It feels like a weight or like a pressure, like a squeezing sensation, and it's associated with other things like shortness of breath and so on. Diabetics, however, have a particular problem because they have damage to the nerves, and therefore they may not actually experience chest pain at all. If they do, it may not be the typical angina which we would normally expect a patient to describe. Okay, so oftentimes diabetic patients who are having cardiovascular disease will say that, doc, I just feel a little funny sensation in my chest, a little discomfort, I just feel short of breath, or I'm walking up the stairs, or I'm running after my grandkids and I find that I'm just out of breath.
The rest of the diagnostic process, however, is similar and may include an echocardiogram (ECG), blood works, or various stress tests accessible at public health facilities and at the Heart Foundation of Jamaica. Generally, diabetic patients will have elevated blood sugars in their urine, which, if identified, serves as a red flag and need for more specific testing. A urinalysis or urine dipstick test is generally done as part of school medicals, oftentimes as a screening test for diabetes. As with every illness, early detection and prevention is key to having good health.
It would be good every year for every person to be checked. If you're diabetic, you would have been told how often you need to check your blood sugar by your health professional. But if you're just doing checks and you're healthy otherwise, then at least once a year to check your cholesterol, your sugar, your blood pressure, do your ECG to see if there is any abnormality in the heart.
The treatment of cardiovascular disease in diabetic patients is more holistic, involving lifestyle changes to include diet, exercise, and maintaining a healthy weight.
In a nutshell, we advocate for, eating primarily fruits and vegetables, things like whole grains and nuts, limiting one's intake of fast foods, foods with high fat content, high cholesterol, salt, and so on, and portion size management as well.
More unprocessed foods, less of the very refined high sugar foods. So there are those foods that are obviously very high in sugar. So the typical recommendation, if you look at a plate, half of the plate should be more plant-based foods, leafy vegetables, and some fruit.
In general, 150 minutes minimum per week of moderate exercise such as swimming, brisk walking, jogging or cycling is recommended. Besides the lifestyle changes, clinical treatment through prescription drugs and surgical procedures is an important element in caring for persons with cardiovascular complications of diabetes.
We have medications to address symptoms, we have medications to prolong life. And that forms an important part of the approach. There are a variety of procedures which diabetic patients and other non-diabetic patients may qualify for, or it may be necessary to pursue. So we speak of things like stenting, for example, coronary artery bypass grafting, which is of course open heart surgery, major surgery. Diabetic patients we have a lower threshold for referring diabetics for that kind of procedure just because of the severity of their disease.
Medications developed primarily for use by diabetic patients have been shown to have significant cardiovascular benefits as they reduce the risk of death and complications related to cardiovascular disease in diabetic patients. But with most of them still under patent, access is quite costly. Your best treatment option is to adopt healthy lifestyle practices that make you less prone to developing diabetes or cardiovascular disease.